So we're going to take a look at a couple different things from the aligned perspective of what we see with patients in office. Marty talked about the ability to be able to bring that hip back and come down forward. A lot of times with low back patients, we'll see that golf quite often is that they will rotate here. You'll get a little bit of movement in the hip, but you won't actually, you'll get all the movement from here. So you're getting a lot of this rotational torque that will put a lot of pressure on the lumbar spine and cause that irritation. That inability to bring the two together is what drive that hip forward and allow that pressure to come off the back. So let's take a look at what Marty's doing. So from here, actually no, you can face the camera. So now let's take a look at if it's a bad one. So if he's doing it incorrectly, what you'll see is that the lumbar spine and the thoracics will move without the hip, and the hip will pretty much stay almost neutral. When he comes across, he's going back and swing through a little bit. He's twisting and he's using his mid back and shoulders to finish out the motion. You won't get a lot of power from that, especially if you're not using the hips. He talked about earlier being able to sit through the feet and generate that power through the whole kinetic chain. So if he's doing it correctly, go ahead and sit back on the hip. So go ahead and swing back. If you pause here, you can see that hip is pushed back. So there's a movement that's happening that's combining his lumbar spine and his hip together. And when he comes through on the swing, he's able to utilize, and you'll see the motion through the whole area.